Surgery for breast cancer.
Why I choose to discuss the breast cancer? Para malaman ko at ng ibang kalalakihan na ang breast ng babae ay hindi laruan na pwede mo lang hawakan. First of all, mahirap maging babae. And part ng pagiging babae ay ang pagkakaroon ng malaking breast. Pero what if ang pagiging malaki ng breast ay merong dahilan? Good day everyone! My name is Roldan Sistrero and I'm here to explain the surgery for breast cancer. So, what is breast? Breasts are made of fatty tissues that contain small chamber called lobes, where breast milk are made. The milk travel to a tiny channel called ducts to reach the nipples. Lymph nodes are located inside your breast and under your arms. They are connected by lymph vessels and help your body to fight the disease. What is breast cancer? Breast cancer occurs when the healthy breast cells become abnormal, grow out of control, and form tumors. Breast cancer can sometimes spread to other parts of the body. About 1 to 8 women have the lifetime risk of having breast cancer. For men, the risk is 1 to 1,000. Breast cancer that develop inside the milk duct is called ductal carcinoma in situ, DSIS. When DCIS is spread in the surrounding tissues, is called invasive ductal carcinoma or IDC. So, what is the treatment for breast cancer? Treatment option: surgery, chemotherapy, radiation therapy, hormone therapy, and targeted therapy. There are several surgical options depending on the severity of the cancer. Allopectomy removes the tumor and clear margin of surrounding tissues. These procedures are always followed by radiation therapy treatment to kill unseen cancer cells. Mastectomies involve removing the entire breast. After a mastectomy, a woman has the option to have reconstructive surgery where a new breast is created using implant or skin flaps. In some cases, the surgeon is able to preserve the nipple. Sentinel lymph node removal is typically performed in addition to the lumpectomies and mastectomies if there is no clinical evidence that cancer has spread to the lymph nodes. Here the surgeon will remove one or more of the first lymph nodes, draining the breast and check if for the presence of cancer cells. If these nodes are clean and it's not necessary to remove more lymph nodes, however, if cancer has spread to these lymph nodes, a complete axillary lymph nodes disinfection or removal of most of all the lymph nodes in the armpit area or may be recommended. Chemotherapy is a treatment that uses drugs to stop the growth of cancer by either killing them or inhibiting their cells division. Once the blood enters the bloodstream, they can travel and reach the cancer throughout the body. Radiation therapy is performed following surgery or in a combination with chemotherapy. It uses high-energy radiation beams or particles to kill remaining cancer cells or keep them from growing. The main types of radiation therapy are external beam radiation, internal radiation also known as brachytherapy, and intraoperation radiation. An external beam radiation such as intensity modulated radiation therapy or IMRT, a machine called a linear accelerator delivers radiation beams from outside of the body of the cancer. It treats the breast from different angles while precisely targeting the tumor. Internal radiation therapy can be used after a lumpectomy or for women with early stage cancer. It treats cancer from inside the breast using hollow applicator with the radiation source passed through them. The interoperative radiation therapy. Radiation is delivered during breast sparing surgery such as lipectomy after the tumor is removed. The radiation source may be an external beams that comes a linear accelerator, or the radiation may be applied internally by inserting the spherical applicator from the mobile X-ray devices in the breast. In either case, the radiation is limited to just the tissue that surrounded the tumors. Most breast cancer are hormone receptor positive, which means they need hormones in order to grow and spread. Hormones therapy work by blocking the cancer cells from receiving the natural hormones that they need. Tests on the tumor shows if it has these hormone receptors. Targeted therapy use special designed drugs such as monoclonal antibodies that act on specific molecules inside and outside cancer cells. Tests on the tumor samples can tell whether they have target molecules for these drugs. For example, Herceptin is antibody drug that target and slow the growth of HER2 positive tumors. These tumors have a high amount of 2 receptors, which are the target molecules of the drug.